Thank you so much for that elaborate discussion on the effects of these herbal treatments on the body of a child who has been administered these medications. So, what now do you do medically once you find them to have the effects of these herbal treatments?
So I think one of most importantly, we attend to them as in critical care. These are patients who actually need ICU or intensive care unit, intensive care treatment, and these children might need to be mechanically ventilated. They might need to have different antibiotics that are given and different lab tests that are done. I think one of the major challenges that we have is because we do not know the exact components of these herbs, the chemical composition of these herbs, we might not have an antidote that is precise to this to the effects that these children come in with. I think sadly and unfortunately, most of these children succumb because of the lethal doses of toxins that they have in their bodies. Of course, we've had several miracle stories in which they have recovered. However, when they come with this severe multi-organ damage, the survival rate for these children is very low. And so in terms of medically, we do mostly supportive care. We take care of whatever organ that is failing at that moment. So first off, we treat the infection because they come in severe sepsis, and therefore we give antibiotics as we await probably cultures of blood where we can identify exactly what pathogen is causing the infection. We take care of their skin. If they are in burns, we take care of the skin excoriations. And then, of course, we give fluids, and so you find also these children have some form of malnutrition because they've not been feeding well. So we take care also of the nutrition of these children. Like I said, mechanical ventilation for those who are not able to breathe on their own at that moment. Yeah, and things like that.
Thank you so much. From that discussion about the treatments that are given to these children, you've talked about intensive care, which is very limited in this part of the world. Even globally, it's very limited. So we should really focus on prevention, I believe. What are some of these prevention strategies that can be taken, or measures that can be taken to help sort out this problem of herbal treatment trials in children?
I think first and foremost, we have to recognize that in the ancient times, herbal medications were used and they seemed to work. And we want to just put it out there that they used to work because maybe they were trained medicine men who culturally would formulate these herbal treatments. However, right now, we recognize that because of different things, we don't have the authentic herbs, and also they are very adulterated. You find herbs that are mixed with other medicines that are being given in the hospital, and this gives the adverse reactions that we see our children presenting with. Therefore, one of the most important things I think we can do to prevent herbal intoxication in our children is to do good community education to the mothers, to the fathers, and also to the grandmothers of these children. Because as I've stated before, we have found out that most of these children are given herbs by their grandmothers, not necessarily their mothers. And these mothers are probably defenseless when it comes to that. So teaching our mothers and our grandmothers, starting from the beginning, when the lady becomes pregnant, we talk to them in their ANC visits. We talk to them, we ask them to bring in the primary caregivers who will be present when the child is growing, so that we can have this conversation and demystify the myths about herbal treatments, so that we can prevent intoxication. I think from the front line, if we prevent the use, then we take care of the adverse effects by protecting our children from being given this therapy.
Thank you so much. So those are very key issues: education, demystifying these myths, and these are done mostly by healthcare workers. Are there things that the government can do specifically to counter this?
I think in terms of the government, one of the things we can do is to really empower our doctors, empower public health officers to be able to go out there in the community. If we have trained doctors and clinical officers and public health officers and community health workers who have been trained through the government and to go out there, they can be able to really help counter the use of this herbal medication. Like I said, again, the reasons for having this for parents and guardians of these children using herbal intoxication, apart from just the superstition, is also the poor health-seeking behaviors. So once a child is sick, they try and do whatever they can. Right now, probably the poor health-seeking behavior is probably from lack of finances to be able to go to a hospital, the distance from their home to the hospital, just the availability of healthcare to these children. And therefore, if the government can help in establishing centers and the government facilities to be functional, to be effective in treating these patients, then it will be very, very helpful. So, so that instead of these mothers and their grandmothers resorting to just what can be found, they can know that there is available healthcare in all facilities, even including government facilities, where they can seek for help early, so that these children do not suffer.
Thank you so much, Daktari, for that elaborate discussion. I believe all our viewers have really benefited from the points that you've put across, and you have really gone to the depths of the causes and how these issues can be addressed. So we are really privileged to have you. Thank you so much for accepting the invitation, and we wish you well in your endeavors as you continue to care for children. Thank you for watching this episode of Medical Media Kenya. Ensure you subscribe to the channel and click on the bell to be notified once we premiere. God bless you.